Hello and welcome to this episode of Let's Talk About by Kangaroo Minds. I'm Vedika and today we have with us Hiba Siddiqui. Hiba has been passionate about psychology from ever since she was a young girl, and her journey began in interpreting and understanding human behavior. She attained her bachelor's as well as her master's in psychology from the University of Delhi and the Tata Institute of Social Sciences, respectively. Her primary years in training and education landed her with her first job in a healthcare setup, and it is here where she developed her interest in working in the space of cancer care and mental well-being. Following this, she pursued a professional certificate in Psycho-oncology from the University College Dublin in Ireland. Hiba currently works as a senior psycho-oncologist at the Max Institute of Cancer Care, part of the Max Healthcare Group in Delhi-NCR. And she's also currently pursuing her PhD from IIT Hyderabad. With an experience of over 10 years in this space, Hiba's interests lie in healthcare and medical psychology. Before we begin our conversation today with Hiba, which will center around supporting and coping with the cancer diagnosis from the perspective of a caregiver, we'd like to put out a trigger warning for our audiences. If at any point during this conversation, should you find yourself feeling triggered or distressed, we urge you to take a step back and look after yourself. Should you need any additional support resources, you can also find them on our website. And now, without taking up more time, let's hear more from Hiba. Hiba, welcome to the episode. It's so lovely to have you with us today.
Thank you so much, Vedika. It's honestly an honor, and I'd love to be part of, these kind of groups. You're doing such great work. So really happy to be here. Thank you.
No, thank you, Hiba. I know, that the work that you do is something which is so important, especially when we look at it from, a mental health perspective, but also more specifically from a cancer care perspective. And, we'll get into that more as we, talk about this through our conversation. But, just at the outset, for our audiences, can you define a cancer caregiver?
Yeah, sure. I think, there are many kinds of definitions, obviously. So I'll try to keep it lay and not get into very textbook here. But caregivers, cancer caregivers, are mostly people who are involved in working with an individual who are diagnosed with cancer, and they are very central to the person, except they're not paid professionals. They're not paid carers. And so that's the difference between a professional caregiver and a caregiver who is, they can be family, they can be friends, they can be central to the person experiencing cancer and its treatment.
Right.
So those are what we usually define as cancer caregivers or cancer carers.
Right. So, Hiba, when we talk about, cancer and a diagnosis of cancer, we've often heard this phrase that, cancer is not something that happens just to an individual. It happens to, an entire family, and it's almost everybody around them, that goes through together. So can you throw a little bit of light on, what are the mental health implications and the emotional experiences of caregivers at this time?
Yeah, I think, when we talk to patients, when I talk to patients, I think a lot of times, like how usually hospitals and healthcare setups are, you go to the patient with a very specific time, a specific frame of mind, and you're just like, how are you? What are your symptoms, etc. But there is this one person, two people, multiple people standing with a patient who are also experiencing all of that through that person, right? So when we look at the reactions at a psychological or a psycho-oncological level, we look at it at a multifold level, right? We're looking at it in terms of the psychological impact, the behavioral impact, the social impact, and the overall impact on their mental well-being, which can be different kinds of things in terms of their spiritual care, in terms of their functionality, in terms of decision making and their general ability to function. So if I break them down, if we look at psychological impact, primarily it's about the entire concept of identity, right? In this present moment, in the here and now, who am I? Am I a partner? Am I a friend? Am I a sibling, a child, a parent? And vis-a-vis both the patient as well as the people outside, how do I define myself? Sometimes there is this dichotomy and dissociativeness which comes in with the interaction and interplay between self and others. There are evident mood changes. Sometimes there are emotional outbursts, including on the patient. You're irritable, you're snappy, they're not having their medications. You're just like, oh God, why are you annoying me? Just get it over with. These kind of reactions. Sometimes, you're forgetful. Sometimes your decision-making abilities are impacted. You forgot to give a medication. You're so caught up. You don't know how to balance and juggle anymore. At a behavioral level, sometimes it spills over to, again, um, sometimes reductions in performance physically. Your aversion to going to the hospitals. You're just like, this board, I don't like it. I don't like this road where it goes. It reminds me of things which, I then have to go back, get here in the morning, go back in the evening. My social life is impacted. Again, bringing to a social space where sometimes you're just very away and distant. You feel very alone, very evidently isolated, right? Sometimes there's a very evident amount of stigma and labeling that the society holds for cancer diagnosis in general. There are ways in which people end up pitying you. You don't like that, sympathizing with you, asking the same questions again and again. So you'd rather avoid than to just talk about someone who's, say, not doing well. So if every day I ask you, how are you, how are you, how are you, your state is not going to change. So then as a caregiver, I'd rather not pick up the phone, not engage with people. So sometimes you feel that these are the different kinds of reactions that I often see in my work, which further lead to maybe fatigue and tiredness in general as well.
Right. So, Hiba, I think it's interesting that, you've thrown a lot of light on, what caregivers go through, not just emotionally, but behavior. And also, like, in terms of physical health, we've seen it take a toll, on a caregiver. But very rarely when we have conversations about cancer care, do we talk about mental health. And even less do we talk about caregiving and, caregivers and what they go through. So, why do you think it's important to address these issues and, support caregivers with their mental health?
I think that would be a question if I talk generically for people. It's also the idea to prioritize mental health care, right? In terms of identifying what it does to you and the stigma that we need to reduce collectively, not just for the other person, but for myself as well. And this is how the normalization begins, that if someone is caring for you, irrespective of cancer, of course, consumes you at a more long-term level, right? It is a longitudinal thing. It's chronic in nature. So the impact is more long-lasting, which is why it's important to know that, yes, the patient has all the studies, all the researchers, all the focus, but what happens to the people who are there with them, who are also the sponges taking in so much from them? It's also that. And that's why it's important to know why caregivers hold a very integral part in their life. If they collapse, if they fall, they shake, or they're fragile, they may not be able to take care of someone who really needs their care and who benefits from that care. That's why it's important to never ignore them.
Right. And, just to build a little bit on what you just mentioned about, the role that a caregiver plays, in your experience, and if you could throw a little bit more light on, like how important is the role of that caregiver when it comes to, supporting treatment, recovery, as well as the mental health of the patient themselves?
Yeah. Well, I think the role that a family caregiver or any caregiver plays is at multiple levels, right? When we are part of a family or even very close friendships and relationships, there are certain roles and responsibilities, even duties for that matter, that are divided. So if, say, everyone can't do everything equally, you can mix and match. So if someone is taking care of A particular space, the other is taking care of B. Now, when the person falls ill or, cannot meet up to those expectations, both A and B fall onto one person. And the roles and responsibilities suddenly take a shift. Now, whether you're equipped to do so or not, you have to run the household. You have to run it emotionally, financially, physically, basic needs, cooking, cleaning, eating, food, organizing, things like that come in. Those take a hit. And many times in my experience, I notice how they suddenly shift expectations that are there from both the patient or the individual who is diagnosed with cancer or experiencing firsthand, and also the family, both during, at the time of diagnosis, during treatment, and in their survivorship phase. That's important to note, that once you're recovered, once you're out of that immediate treatment, survivorship care for caregivers and patients is equally important, right? And so that might lead to conflicts, that might lead to resistances, where this is not what I was expecting. Sometimes there are gaps in not being able to understand what my needs are. A lot of your needs are unmet. So caregivers are also going through these roles. Many times they go through a lot of guilt and self-blame, whether it's for not getting the person for checkup on time, or wanting to enjoy or go to a party that they really can't, or miss eating out something because the patient can't eat. Small joys, little joys of life, or to feel like, oh, I'm not able to manage work life, the way I should, and that's adding burden. But the fact that I'm tired, that also induces guilt. That's my partner, that's my parent, that's my child. Why am I getting so annoyed caring for them? So all of these changes, mentally, physically, emotionally, can occur on the caregiver as well. And of course, financially is another very integral aspect.
Right.
That adds on to the fears and anxieties. Yeah.
Right. No, I think it's interesting, that you spoke about, caregiver burden and sort of that burnout, but also how often that also leads to feelings of guilt, right? Because often you can't express that frustration that you're feeling going through, because again, with caregiving, a lot of times there is this assumption that, you have to be a caregiver, because, oh, they're your relative. If you won't do it, who's going to do it? And I think that also adds to the whole emotional experience, which, as you said, caregivers go through. But coming to the aspect of burnout, because you spoke about it, how do you sort of define that burnout, and, what are some signs of burnout in caregivers?
Yeah, so caregiver burden and fatigue is a very real concept. It's a state in which mentally, physically, socially, many times, like I said, financially, you are extremely stressed. There might be very evident signs of clinical depressiveness and clinical anxiety, and you're not able to balance or function, right? So there's very evident dysfunctionality. Many times what caregiver burden and fatigue does to your roles, etc., is that it sometimes have confusion in roles, right? Sometimes it creates unrealistic expectations that I as a caregiver might have on me, as well as the person diagnosed with cancer flowing onto the caregiver as well, in terms of expectations, which can be very, very unrealistic to sort of attain. Now, those kind of pressures often create helplessness, lack of control, that I may not be able to manage. And I feel very flustered and I feel very, very burdened that I can't sort of, it feels like, literally counting one hair at a time, that kind of a thing. And of course, sometimes there are unreasonable demands that they often put on themselves, that I better be the best caregiver. I better be providing every single thing to this person because their pain is so much bigger than mine, or their worries, etc., are so much bigger than mine. Those are also unreasonable, irrational demands and burdens that you end up putting on yourself. So some of the symptoms can include very irritable behaviors, disturbed sleep, disturbed appetite. So it could be less or more. Sometimes you might have unnecessary, unexpected crying spells. You might have something called the blurriness in the mind. So you're not able to focus, you're very distracted, you're very isolated, you might be very withdrawn. These are some of the common symptoms that we see.
And, Hiba, when it comes to, caregiving, as you said, this is not a paid profession. We don't look at it as one. So very often caregivers are balancing, as you said, multiple roles in their lives. Either they're also holding a job and running the household, as well as looking after their loved ones, be it a family member or, as you said, a friend. So how can they balance these acts and, just so that they can cope better with the demands of caregiving? While also looking after themselves, through the whole process?
Right, right. I think, there are many ways, right? So I think I'm not going to dive into so much of that, but let me look at things that maybe we can talk about more at a practical level that they can do. So I talked about lack of control and helplessness that comes in, right? I think it's important for the person to also know that there are uncertainties that come in at many, pits and stops. There are hurdles which are very unpredicted. Sometimes they're crisis-like, sometimes they're anticipated. So it's important for yourself to prepare for the life transition. That maybe this experience might be changing or maybe impacting the relationship in a certain way, maybe impacting your own journey as an individual, your own evolution. And it doesn't have to be for the bad or for the worse. So one is to prepare for those transitions. The other is to look at a problem solving attitude. I know I can't control the disease. I can't control the trajectory and the nature with which it might be coming onto my person, my family, and all of us together. So what I can do is I can look at the best possible treatment solution. I can have my insurances sorted. I can have my wills sorted. I can focus on what matters in the here and now. Can I spend time? What is the level of functionality both my patient or my, I'm sorry, I'm constantly using the patient word, but my family member can do? What can I do? Can that be helped? Can I withdraw a little? I may not be wanting or required to be involved to the same level that I had to on day one. So maybe I can start weaning off to give myself more time. The other thing is that it's important to heal your relationship. There can be a lot of distance that can come in. There can be a lot of communication gaps that can come in. There can be a lot of resentment, that I'm doing so much for you, but all I hear is this irritability, snappiness. Your outbursts are always on me. Why do I not get a better side of you? So those changes or those things need to be constantly addressed, right? And of course, it's important to, I often tell a lot of people in our team, we quite, we joke a lot, we laugh a lot, and I think those are in that very heavy loaded day of work. I think those are moments which we really enjoy because it's important to laugh. It's important to lighten the mood a little. You're already feeling so morose and so heavy. Uh, just to go out with your friends, have a chat which is not cancer. Have a chat or look at, if you're surfing the internet, you're not looking at cancer symptoms, what to do, what not to do. Look at like funny videos, watch stand-up comedy or watch a fun light show, comfort shows, things like that. And of course, very important to know that if you've already dealt with the worst, you have the resilience. Nobody tells us how much resilience we have until we are experiencing it or a crisis that we have to deal with. We survived COVID, right? None of us knew what a pandemic looks like, what it entails mentally, physically, but we all are survivors. So the resilience we all have, little did we know that we did. Or the fact that, when you are kind or caring and nurturing to the person who's diagnosed, why don't you take a U-turn and look, at an inward level? So start with being kind to yourself rather than, feeling that hypocrisy that I need to only be nurturing to the other person. And of course, if none of these work, then please reach out for professional help. A psycho-oncologist or a trained psychologist working in the health and medical field will be able to help with that. So I guess these are some of the tips that work. I think for me as a person, I've heard from families, which I feel are practical. And it's important to also build your support systems, trust someone you can talk to without feeling judged, a friend, a support group, those really, really go a long way.
You've shared some really practical self-care tips as well for caregivers. But, talking more specifically about psycho-oncology and the role of a psycho-oncologist, because not too many people would even be aware, unfortunately, that this kind of support exists. So can you tell us a little bit about, the role that a psycho-oncologist can sort of play in supporting both patients as well as their caregivers through the entire process?
Sure. I think so. Psycho-oncology is definitely a new field in India. it's obviously something that's practiced and integrated in holistic cancer care, in the Western countries, well before it's now, upcoming, and a lot of people are taking up it. So you're trained and have a background in psychology, and then you're super specialized with a focus in cancer care. So it merges and creates that bridge between the physical and the mental aspects of cancer care.
Mhm.
And again, if it's like I work with a larger integrated oncology unit, so we look at mental and physical care with a similar and equal priority. It is normalized from the day one by every oncologist, every support staff, that there is someone who will be looking after you, or will, at some point visit and uh, see you during this period of care that you might need during the treatment, whether it's a treatment oriented impact, it's an organic impact, or it's a psychosocial impact on the mental health. If it dips or imbalances itself, then you're here to deal with. That's where my role comes in, that in your healing journey, the psycho-oncologist comes in to look after the mental health of the person as well as the caregiver.
Right. So, Hiba, also as a caregiver, have you, would you say that there are some differences in the way, you would care for, let's say a child or a younger adult with cancer versus, an elderly person who's
Mhm.
battling cancer?
I will, Vedika, because I feel like the fears and the anxieties, as common as they are, and I'll actually tell you some commonalities that exist. What's coming in my head. I think that whether it's a child or an adult or young adult or someone who's elderly, it's important to know that there are sensitivities that will be modulated, right? How you are dealing with the person. But the commonality comes in where there is trust. There are questions around knowledge sharing, how much to share, how much to protect, the control that comes in or is given to the person, whether it's a child or an adult or an elderly person, the fears that you feel in terms of your relationship with them, right? And the responsibilities that you are required to perform physically, emotionally, financially, mentally. So if it's a child and an elderly person, the dynamic shift. With the adult, sometimes you treat them more at an equal sharing of responsibility and knowledge, but it can't be generalized. I think my work with them is very, very specific to the family and the person. It's very, very tailor made. So yes, my approaches many times differ, because a parent fearing the loss of a child, a parent fearing the impact of the treatment can be very different than someone looking at dealing with an elderly patient of theirs, with a certain sense of, oh, they're coming with a certain comorbidity, or it might be age related. Whereas a small kid of 1 year old or 2 years, the parents sometimes don't even know how to make sense of what just happened, right? These illnesses or this diagnosis is societally made, expected to be with people who are older, who are of a certain age group, not the younger ones. So you're also dealing with that, dichotomy of sorts with them.
Right. And as you mentioned, with all the sort of, the societal implications of having cancer and the
Mhm.
almost the equating of cancer to death, right?
Hmm.
A lot of
Hmm.
times with cancer patients, you will start seeing that fear of death sort of creeping in, and they'll have a lot of worries around, are they
Okay.
going to recover? What are they going to go through? So, as a caregiver, how can we support and, help them through those phases?
I think the questions around loss and fears around them, rather, uh, they're not completely wrong and irrational, because you see statistics and you see movies and media portrayals of cancer as an illness. We go back to a lot of films that showed it's never a happy ending. So a lot of people come in with those notions and ideas, and I think that they look at grief as a direct aspect of end of life or death, but they may be grieving other things. So grief doesn't only mean that someone has passed on. It can also mean that you are anticipating or dealing with loss of time that you had, the kind of person you were. the fear of not being able to spend that kind of regular or normalcy in routine with this person that you very happily shared 6 months back, 2 months back, 3 years back. And I think that that is where we also grieve loss of time, loss of what could have been. I don't know if this will go back to normalcy. I don't know, and I can't trust that about me. So my faith starts diminishing. That is also what grief does. And I think in that moment, we do often connect a lot of our caregivers to support groups, support systems, other patients who have willingly consented for us to, make them also deal with patients who are surviving and doing, thankfully, very well physically, medically, emotionally, to be able to share that journey and to help them realize you're not alone in this. You're not the only one who's dealing with this, right? For starters, we often give them individual space. I give them individual space to have therapy sessions with them if we identify. We keep the treating doctor in place. We keep them informed that I know they're not in your direct line of control, but that is impacting, say, their relationship with your patient. So it's important to see them. We see them as the duo or the dyad, right? We see them maybe sometimes as a trio. So those are the ways where we give the caregivers their own space to also express, to have that cathartic experience and, share and then work therapeutically with them accordingly.
And, Hiba, you touched upon grief. And before we get into, more around, end of life grief, but let's talk about a little bit about, if you can throw some light on anticipatory grief. Because that's something we don't talk about enough again, and we don't even often recognize anticipatory grief. So, what does anticipatory grief sort of, look like for a caregiver? How can they look after themselves through that time?
Again, I think I'll overlap some of the things that I said, so I won't repeat them. But anticipatory grief is also the uncertainty of the future of the person that I'm related to or I'm friends with. Now, will they die? I think these are questions we don't ask, right? I think we don't have conversations around death. They're very uncomfortable topics. And many times the caregivers fear being alone. That once my family member or my relative or my friend goes, if they do, what will happen to me? Because I'm the one left behind. And there is this very, childlike space of selfishness that comes in, that I'm looking out for myself. What's going to happen after that person? What's going to happen to me? And I feel like a lot of the anticipatory grief stems from that fear. We end up not normalizing talking about death and loss. We don't normalize talking about the idea of grief because societally we're so pressured to think positive, think through this, be happy, be positive. And, the toxic positivity that comes in, we consider it a very negative thinking process, which it isn't. It's very healthy to talk about it. It is a thing. It is very real. And so we need to have this conversation with people and again, hold spaces which can ease these conversations in the process of that journey as well.
I think you're very right. When it comes to having these conversations about death and loss and grief and, even cancer and, even the conversation we're having today, a lot of times people will say that, no, you're being very negative. It's that toxic positivity, which you mentioned, that no, don't talk about it, but it's a very real part of the entire journey of, being a cancer caregiver or, just seeing sort of, your loved ones struggle. And you're probably right that, a lot of it comes from that fear of, what's going to happen to me? Because again, that whole dichotomy of your sense of self essentially has now become that I'm a caregiver. So what happens to me after they go? Who am I? What am I left with? What is my identity? Minus being a caregiver. Because, you've actively been in that role for such a long time, especially when it comes to supporting someone with cancer. But besides survivorship, now when we start moving towards there are going to be people who won't, treatment isn't going to help them or that at the very last stage of, their lives. So in that time, how can we support a caregiver or, just sort of normalize that sense of loss that comes even post your loved one moving on?
Yeah, and I think that's a very heavy responsibility for people that they should really start embracing and taking accountability for. There's a very interesting grief therapist. His name is David Kessler, and he basically talked about the stages of grief. He added with them and said, what after the last stage? How do you give what is he basically gave the concept of meaning beyond grief. So he often said that the society expects us to grieve in a certain way and doesn't expect you to move on, right? And there were conversations around comparison. I'm more sad than you. My grief is bigger than yours. My loss was worse because, I suffered for 6 months, but you suffered only for 1 month. I think we need to, as a society, collectively stop doing that. You're not getting a bravery award. The resilience cannot be quantified and compared. Everyone's way of handling grief, handling people is very different. So if someone feels like they're losing on social gatherings and outings versus someone who says, but I'm much more worried about my parent who's about to die, they both can still be the same. No judgment passed. So as a society, we need to not put our problems forward in the attempt to making them feel lighter, that your problems are not as bad, look at mine, that's so bad. Just give them the space to talk. Don't try to hog their moment of expression. Don't judge. Don't tell them statements like time will heal, be positive, have faith, you should think positive, the person will heal. That's adding on to the burden to the caregiver because they feel guilty for not thinking positive then, when they're very evidently seeing something which is realistically not going to reverse. So when someone's going through loss, just check in on them, maybe without asking, how is the patient? How are you today? Just say, hey, dropping in a hi, like, you want to get on a call. Treat them very regularly, like you would have conversations, talk about your life. Sometimes people get very awkward and they feel we're walking on eggshells. So I can't discuss my life problems because they're not as bad. The comparison also ends up reversing in that situation. So you feel very distant that how can I share a happy news? Maybe they'll actually like it, try it. Check in on them. Can they take it on? Assess how their day is. Take them out for a cup of coffee. Bring coffee to them. Maybe just go home and visit them because they can't get out. Small gestures like this, like these go a long way. And that also shows that you're there, but you're not like, prodding over every day how you're feeling, what's your emotions. It's not going to change, especially if someone's, towards the end of their life and not really improving, unfortunately.
Right. And I think, that's really interesting that, you've also shared some tips for, how common people around caregivers can sort of, support caregivers. And, it's not about all the time trying to induce positivity, but also sometimes being very real about the situation, acknowledging it for what it is, validating whatever they're experiencing. Because some people might go through, very different feelings. As you said, some days will be sort of a sadness, that anticipation. There'll also be feelings of guilt or, just anger and helplessness also that I think comes in with being a caregiver. Which a lot of times we don't recognize, or, we try to say things like, oh, look, they're going to be in a better place, or, all those kinds of remarks also that, oh, at least their pain is going to end. But I think as a caregiver, we don't realize that emotional attachment sometimes doesn't see all these feelings, because you don't want to see your loved one go. It's that striking that balance between, what is genuine empathy versus, are you adding to that feeling of toxic positivity around the person?
To also just, one more thing, that to allow the feelings of vulnerability, irrespective of, the gender that you identify with. I think it's important to just be okay with knowing that it's okay to ask for help, right? It's okay to have a bad day. It's okay to just, be very hopeless today. Those are also emotions which exist. and they can all coexist. I can have a very positive day today and a very, very hopeless day tomorrow. But that's also what makes me human. And I need to humanize rather than demonize these, these emotions that may not sit very well with the larger society or the realm of, the community that I probably exist in, sort of a thing.
And I think you're right, when it comes to vulnerability, not just for caregivers, but also sometimes the way you feel about, the person who's going to go. Because a lot of times, especially if they're elderly, people will say that, it's okay, they've lived their life. And I think as a caregiver, it's partly that grief about, what could have been. You're not ready to accept that, yes, they've lived their life, but, does that mean that you're ready to let go? I don't think so. I think it's going to hurt, irrespective of the age of the person going. Because obviously you have that emotional attachment to the person. And I think, we need to hold space for those conversations as well.
Absolutely. Yeah. Yeah, that's true.
But, Hiba, to wrap up everything that we've spoken about today, what would be some advice that, you would leave with someone who's watching this or listening to this, who might be having a hard time right now with their mental health?
The one thing I say to a lot of people that please don't hesitate to reach out to a psychologist or a psychiatrist for medications if needed. You're not proving your resilience to anyone by reaching out to professional help or to someone that you can have a space of this unbiased, comfortable space. It doesn't make you quote unquote weak. It's very, very it takes a lot of strength to talk to someone, to be open to your own vulnerabilities and accept that you're going through something. Don't hesitate. Because if you do, you don't know the long-term consequences that it will have onto you as a person as well. So if you're grieving, if you have grieved, if you've lost someone, don't underestimate or don't follow people's timelines. Your timeline is what works for you. If it requires external help, then please don't hesitate or don't resist it. I think that's something that I usually tell everybody. All of us, should prioritize our own mental health. All of us should be in therapy to just understand ourselves better, maybe.
No, but thank you for that. And, thank you for all your insights and for everything that you do, to support people, to support families, to support loved ones who are coping with this. Because we know how many families go through this, and we know the impact that, cancer has, not just on patients and not just on physical health, but also on, mental health and well-being. And I hope that, for people watching this, that they feel a little less alone and that they realize that it's okay to reach out, even in cancer care or even in general. You don't have to just deal with physical health. It's equally important to look out for yourself, to look out for the mental health of people who are struggling through their entire journey, with cancer. So thank you, Hiba, for being with us, for all your time, for all your insights. I think it's been so wonderful speaking to you and having this conversation. And
likewise, Vedika, sorry. Thank you so much for, the invitation from Kangaroo Minds. And I hope it reaches the right audience, and I hope it does, reach someone who might be struggling and might feel a bit healed by understanding that they're not alone.
And lastly, for anyone who's watching or listening to this, we hope that, that you remember that there's always hope out there. There's always help out there. And, even as Hiba said, you don't have to go through this alone. You are resilient, but you don't have to compare that with somebody else. We're all going to go through this in our own way, and that's okay. So till next time, please stay well and stay healthy. Thank you.